Thanks for the wonderful introduction. Thanks for the organizers to be able to come here. Besides my academic career, I'm still working operatively in the field together with my wife. We run a small center in south of Austria, working with children in the context of mental health issues of mental ill parents. So we focus on a new group of vulnerable children, children who live in the context of persons who are vulnerable in terms of his and her mental health issues. So I want to talk about family-centeredness, and I appreciate what I heard during the last days. And well, I didn't organize the structure of the presentation, but I think it will be one step further what we heard during the last days. So to have a short idea from where I'm coming, the animals might be similar. Okay, so how I will structure my presentation is how can we understand family-centeredness, what are the current findings in that field, and what will be the challenges here in Australia and in further countries, and there will be challenges as we heard from Barry. So what will be your take-home message? It will be, and I'm going a little bit beyond what we heard from Mark and what we heard from Barry. My hypothesis is that family-centeredness is a little bit more than engaging families, involving families. I will give an answer on that. What we might understand with family-centeredness in a broader sense. The second take-home message is family-centeredness is based on what families are able to do. Well, this is a very naive sentence, what families are able to do, but we have to think that this is the basic. Yeah? So we should not start from our concepts, what we suppose that families should do, but we have to go from the basics, what families are able to do. And in practical, it means if you succeed that a mother or father with personality disorder joins your appointment, comes on time every week or every second week, or if he or she is at home when you offer your service, this is success. Yeah? Don't think of empowerment, of developmental gains. Just think that opening the door, being able to have contact to the child and the family is a big success. And that's what families sometimes are able to do. The third take-home message will be families and professionals might have different understanding of family-centeredness. We ran a big study last year or two last years. In Germany, we asked parents what they understood by family-centeredness. And surprisingly, it was not always what the professionals understood by this term. I will talk about that. Family-centeredness is a professional attitude which can be trained and not a question of setting. And I remember the words of Mark. So it's ABC, it's attitude, behavior, and it is content. Yeah? It's not only attitude, I am family-centered. Yeah? You have to show it, it has to be reflected in your behavior. And family-centeredness makes a difference in early intervention, even if scientifically this might not be as big as we expect. So a little bit the myth that we will save the world with family-centeredness, unfortunately it's not like that. Okay, I appreciate very much what Perry told me and during the last 2 years. The starting point is what do families need or what also they are able to contribute. Yeah? So think that families have some needs, and this is a very difficult question, which need they have, because the basic need they might have, and I heard it from Diane yesterday, the basic need is my child to be okay. The basic need might be, you as a professional, I do not need you. This is a difficult message for us as a professional. Yeah. So when we talk about, this is a little bit too quick. When we talk about the needs of the families, all families need communication. Most of them need liaison. Some need education, some support. But we also have to think, what can they contribute? So if we talk about a coaching model, or in most European countries we would call it a partnership model, we also can focus and have to focus what parents can contribute. And I'm also convinced that there will be some major changes here in Australia. So if you introduce the new strategy, you will move from a partnership model towards a consumer model. And this might have an impact on the relationship between the professionals and the parents. Yeah? Because you might have parents who wish to consume a service, because they are consumers of the service. And I'm not always sure if parents of a small child, of small vulnerable child, might be able to assess the rational way of consuming a service. So this is a little bit of concern which I have related to the new strategies here in Australia. And there are some comparable data about these issues in Netherlands and also in Austria. So what do we mean by family-centeredness? We are middle of the center of the universe. Family-centeredness refers to a particular set of beliefs, principles, values, and practices for supporting and strengthening family capacity to enhance and promote child development and learning. It has come to be widely used and accepted. There is a lack of common understanding, and, well, as Mark highlighted yesterday, there is a high heterogeneity in the praxis. Family-centeredness characterizes beliefs and practice that approach families with dignity and respect, individualized, flexible, responsive practice, information sharing, family choice, parent-professional collaboration, and the provision and mobilization of resources. I guess you all know that. That's nothing new. And I read the paper which was in the package, and I mean it's just copy paste, or it's the same like we see here, that parents know the best and want the best for their children, that families are unique, that the optimal child functioning occurs within a supportive family community. The family, not the professional, is the constant in child's life, that the family is the best position to determine the needs and well-being of the child, that the family has the capacity for choice and decision-making. So, coming back to Carl Dunst and his colleagues, family-centered practice is a systematic way of creating a partnership with families that treats families with dignity and respect, that honors their values and choices, and provides support and strengths. Well, and now I wish to ask you, well, who of you, would any one of you state in this public forum that he or she is not practicing in this way? No. So why I'm talking about this? We run a research and we were asking parents to assess the family-centeredness of services in northern Germany. We had approximately 1,500 parents. And you see, what you see is the difference of assessed services. So this is how the parents assess their service, and there is difference. Yeah? I mean, the scale is from 1 to 5. 5 is the highest score, so we are still in the green area. Yeah? So parents, yes, believed that the service and assessed that the services were very family-centered. However, there is difference, and parents were able to assess this difference. So. The first making difference is family-centeredness is more than involving engaging of families. So this might be a little bit paradox for you now that I say family-centeredness is more. Yeah? And I refer to the findings of Gerard Mahoney, who clearly states it's not enough parents to be educators for their children. And I heard Diane in the morning, yesterday. Yeah? So it's not the position of the parents to be educator. And unfortunately, we find, based on empirical data, that the effort of parents to be educators doesn't show any not significant impact on the development of child. So it's not training the child. It's not me as a parent to be educator. But then the question is, what is it? Yeah? And I refer to data we saw yesterday. So just see how many learning opportunities the family provides and how many learning opportunities during 1 year the professionals or educator could provide. Yeah? And it's the same what Mark said yesterday. Yeah? So we are giving small impulses. Yeah, but in reality, the learning, the change is initiated within the family. And here we're coming back, the family is able to do what they are able to do. So I see the engagement of families much broader in the term of participation. And well, if you would have asked me 10 years ago, I would say, yes, let's do more training, let's do more stimulation for the children. Now I see it a little bit more in a different way, especially talking to our colleague Margaret from Israel. The main issue I see now is the sense of belonging, the sense of participation, the sense to be active, to do something in a meaningful way. So this is what I understand and what is going beyond engagement. It is belonging to somebody, belonging to a family, belonging to peers, belonging to other groups, which at the end defines the quality of life of families with a disabled child. And this is sharing and being able to influence his or her reality. Yeah? And well, as we work in still in the practical work, recently a young mother with 2 children in foster care came to us. She gave birth to a 3rd child. Yeah, and this mother she took care very kindly of her newborn baby. So she gave her the bottle and went with the baby through our room. And touching the baby, and it was 20 minutes, but it was silent movie, yeah. And her 2 children in foster care both showed expressive language disorder. So after 20 minutes, I told this mother, and it's all about parenting, what you told us yesterday. I told this mother, yes, you're doing fine, how you take care of your baby, yeah, how you carry your baby. But do you have any idea how you can promote a little bit more the world and the reality of your baby? Well, she had no idea. I said, okay, maybe there could be one idea you explain to your baby while you're walking in this way. You're explaining what you're seeing. Yeah. So the mother started to explain to her baby, well, look, here's the window, and here are some birds, and do you listen to the birds? Yeah. So she started to explain to the baby the reality, and I gave her very positive feedback. Yeah, and said, oh, you did very well. And the mother told to me, but nobody told me before, yeah, that I should speak to my baby. I said, yes, but try to do that. Well, that's one part of the story. The second part was I was phoning to the early childhood interventionist who was in the family, and I told her, yes, we were working with the mother. I told her what she might be able to do, and the early childhood professional told me, yes, but I tell her every time. Yeah. And that's what also you said, Mark. Yeah, it's not only the exercising of the child to learn this ability. Also, some of our parents need this exercising of the parenting. So it was not enough just one time to tell her, explain to your baby the world. She heard every time, and she had to be reinforced every time. Yeah. So sometimes we tend to overestimate our intervention. If I say something one time, it will work. Also, our parents sometimes need this kind of reinforcement and repetition. And data of Jared Mahoney clearly state, so responsiveness, this ability to increase the sensitivity of parents, what we heard yesterday from Mark, responsiveness is the key issue in promoting sense of belonging, promoting self-efficacy, promoting development of children. Yeah, and again, another practical story. We had a family coming to us, sent by social services. It was a father with ADHD, and the mother had a diagnosis of personality disorder with depressive features. Yeah. And social services were a little bit afraid, are these parents able to take care of their child? Yeah? So they came to us. I asked them, please play like at home. And there is a video in the internet about this. And they were standing like this, and the child was very self-efficacious, was moving and was very active. So there were really good resources. There was good resilience of this child. And the parents were standing like this. I said, okay, please play like at home. Yes, we're doing. Yeah. So it was 20 minutes, 25 minutes. It was very hard for me to watch this. Yeah? I saw a child which was turning, a child which tried to grab something. Yeah? And I said, okay, listen, you're doing well. Yeah? So you're observing a child. Maybe do you have any idea how to play with your child? Yeah? Yeah, not so much. The father goes to the child and touches the child. Yeah? He took a ball and rolled the ball. Unfortunately, went to the face. Well, then I said, okay, listen, I have one idea. Yeah? Do you have an idea how to play with your child? Yeah? What is important if you play with your child? So first, make contact. Hi, I am Papi. I want to play with you. So have a contact. Then switch your attention, joint attention to the object. Look there, there is I don't know, a doll or a car or whatever. So make a reference, yeah, and then act. Yeah. So we did a very easy training. First, look at your child, then look at the object, and then do 1, 2, 3, like a triangle. Yeah, and the father understood this. Yeah, and we did this. We repeated this, and it worked. Yeah, so sometimes we were talking about parenting. Sometimes some of our parents need these basic skills, which we usually call intuitive parenting, which some of our parents might have difficulties to perform. And that's on a practical level what we understand by responsiveness on a practical level, because we have also not to forget that we have to transfer all this knowledge from science into the practice. Especially if you work in the field of disadvantaged families, and I do follow the assessment of Barry. In a current study in Germany, we found out that 80% of our children in the early intervention services have unspecific developmental delays. So no classic diagnosis, no genetic disorder. Yeah, and sometimes our families do have other priorities than we have as a professional. Yeah. And check your own priorities. So, because sometimes I have the feeling that we as a professionals, we overestimate the capacity of the family. Yeah, because we give the message to the families: take care of your child, be empathic, focus on the resources, create a supportive environment, comply with the recommendation of involved others, cope well with the disability, be a good enough mother, father, focus on the siblings. Besides being a parent, be a partner for your partner. Organize daily activities, take care of your social network, self-realize yourself, take time for yourself, engage yourself as a citizen. If I think of our families who struggle with financial issues, with with housing, sometimes I think that we are overwhelming our families with our ideas how perfect parenting can work. And I think sometimes we have the picture that we are expecting the super mama, the super papa related to our children. And the question is, are you as a professional able to do these things? And in our research, we found out that family-centeredness, we have to be very careful if we talk about family-centeredness. So if we talk about family-centeredness from the parents' point of view, they wish match of appointments, meetings, visits with their timetable. They wish you to be flexible in case of unexpected events. They wish you to be supportive. They wish you to let them decide. If you see the family-centeredness from the professional point of view is, well, please be at home when I have time, when my kids are in school. Yeah. Please follow our individual family support plan. Please, we should be efficient. We should have some clear outcome. Yeah. And please do what I think is best for you. Yeah? So there might be sometimes a non-match between the family-centeredness, the concept of family-centeredness between the professional and the family. I will come back to that. Especially when we think of the academic approaches toward family-centeredness, but we have heard about a lot of that. So it's family orchestrated parent-child interaction by Mike Guralnick, relation, empathy, honoring strength by Carl Dunst, family systems-oriented siblings, grandparents, setting environments, daily routines by McWilliam, joint decision-making by Carl Dunst, parents' need and competences by Franz Peter Rander from Germany. If we ask the parents what they understand, it was an open question. Yeah? They say, yes, family-centeredness is taking account of the family context. And that's the important thing. We currently are running a project on ICF-CY, and I invite you, this is now the publicity, I invite you for the workshop on Saturday, how the ICF-CY can be put into practice in early intervention. So the family focuses much more on the environment. Yeah? Take care of my context, take care of the siblings. The second issue families understand by family-centeredness is counseling. And the third issue is engaging the parents into the process of intervention. These are the main categories parents understand. And the main category here with 525 answers is the environment. Yeah? It's not doing something, but take care, please, of my reality, of my environment. And there are some very easy questions related to supervision or evaluation of your work. To what extent do you follow the timetable, speed, and goal of the family? To what extent do you speak the language of the family? Is your individual family support plan understandable for family? Yeah? Do they understand what is written there? Yeah? And it is a little bit tricky. You write it in a team and you present it to the parents. This is not participation. Yeah? This is preparation. Yeah? So if you really take serious this concept of full participation of parents, the concept of individual family support plan should be a cooperation between the parents and you. Yeah? Who is talking more during the process of establishing an individual family support plan? The family member or you as a professional? Yeah? Do the families have full access to the documents? And I appreciate the idea of Barry. We currently work related to internet access and documents which are accessible for parents. Yeah? So you have your documentation in the internet and the parents can access and see what you're doing. It will change completely the way you will describe parents and children. So if you think that the parents online can see what you are doing, yeah, you will be much more careful in labeling parents as non-compliant or whatsoever you label. Yeah? You will be much more on a behavior observable level, yeah? If the parents are able to see what you're doing. Yeah? And my hope is that we will reach the fathers by using information communication tools. Yeah, so that the father might go online with his smartphone to see what the child is doing in the kindergarten. Yeah, so what I know it's a little bit tricky because of control, yeah, internet issues, yeah. But I hope that the cooperation with parents might be increased by this. Okay, so a little bit of literature and science. I'm looking at the time. Yeah. What we can see is that the parents are able to assess the degree of family-centeredness, so they can differentiate. They know what is family-centeredness. Yeah? The services differ. We saw this in the German study. The expected and requested family orientation is higher than the perceived one. Yeah? So the professionals tend to overestimate their own family orientation. And parents assess practice in early intervention less family-oriented than professionals do. And also for self-evaluation, just check this scale. It's the Dunst scale related to family-centeredness of services. Just go through it, yeah? And be aware, always means always. Yeah. So do I always promise what I do? Yeah. Or do I do what I promise, and so on. Yeah. So this could be an easy instrument for your service together with the parents to see a correlation between the family-centeredness of your service and service assessment of the parents and you. Yeah. And we used it in Germany. On a practical level, how much time do I invest in support intervention process with parents? How much do I support process with child? We heard numbers yesterday from Mark. In a current pilot study within our ICF project, we checked the used codes of professionals. Yeah? So which codes, who is familiar with the ICF, you have the structural, the structure, the body structure, functions, participation, and environment. Which codes do the professionals use in their individual family support plans? Yeah? And it was 90% they were functional or structural or participation codes, only 10% were environment codes. So in our heads, we are focusing on the family, but in using the documentation, in using the key issues of family support plans, we don't have the parents' insight. Yeah? One of my hypotheses is, okay, we heard it yesterday from Mark, we might not be trained to work together with parents. This is one issue. Second issue, it is much more difficult to work together with parents. Yeah? Because a child, if you work with a child, usually you offer your relationship and the child will easily accept this and will have fun. Yeah? But if you work with parents, you might have resistance, you might have a dispute, you might have arguments, so it's much more difficult to work with parents, and if I can avoid it, I might do that. Yeah. Okay. What we also heard yesterday is centeredness makes a difference. We see greater satisfaction with services. We see greater feelings of control, participation. We see higher program appraisal. We see higher parental perceived confidence. All these items are correlated with family-centeredness of services. So it makes a difference if you work in a family-centered way. The correlation between family-centeredness and stress is not so clear. Yeah. So most of the researchers says yes, family-centeredness is seen as an added value to the program. It might represent a moderating function. And the difficult news is that the correlation between family-centeredness and outcomes, child outcomes, is quite weak. Also due to methodological issues. So to have a summary of this second part, it is the main impact of family-oriented services is perceived self-efficacy of parents, satisfaction with the services, and the impact on child outcomes can be hypothesized, although the empirical data base is weak. So to pass to the next point, shortly some current research we had in Germany. Also in Germany, there is a discussion about how to organize the services. It's correlated with financial issues, and I do hypothesize that also your new strategies here in Australia also have a financial background. Yeah. But we had a similar strategy in Austria in 2004. So the government tried to implement the idea of tailor-made services for the families, yeah, and to look more closely on the needs of the families. Yeah, they had the idea that this will save some money. Unfortunately, it went the other way around. Yeah. If you take a close look at the needs of families, if you listen to families, what are their needs, service delivery will increase. They will report more needs. Yeah. So I'm a little bit skeptic if this strategy here will be successful in terms of financial issues. Yeah. Okay, we were interested how the families perceive family-centeredness and whether the family orientation of services correlated with outcomes. And we were interested whether family-centeredness is correlated with the place or delivery of services, because there is a big discussion in Germany, should it be at home, like home services, or should it be in the kindergarten? Or in a crash, because we see that more and more children from early years, because of employment of the family, are not at home, but in kindergarten or crash system. So, and what I can tell you preliminary, there is no correlation between the setting and family-centeredness. So, if a child has the service at home, or if the child is in kindergarten, if the professional works in a family-centered way, if he or she has a communication with the parents, if he or she listens to the needs of the parents, there is no difference in family-centeredness. So family-centeredness is not correlated in our study with the setting. Yeah? But it is more difficult in kindergarten to reach the parents. That we have to say. Yeah? Okay, so some empirical data. We reached the mothers, which is usual. Mothers answer the question, not the fathers. The percentage of single parent in our sample was quite low, and one of our hypotheses is that we did not reach the social disadvantaged families. Yeah? They did not answer the questionnaires. Yeah? So there is a little bit bias in this sample. Yeah? The average program intake was 30 months, and I discussed yesterday with some colleagues here, it is too high. Yeah? So children in average were 2.5 years when they were taken into the program, yeah? Which in terms of prevention is too late. Yeah? I mean, you see this high column here. These are the children with genetic or diagnosis or with a clinical somatic state. So they are very early in the programs. Most of the children came into the programs when their language development showed some problems. It's about 30 months. So there is no wonder that it is this date. Yeah? What surprised us is that significantly girls came into the programs 3 months earlier than boys. So still we have these ideas, well, leave him a little bit. Yeah? He's a boy. Yeah? But there is a significant difference. Yeah? So a little bit take care of the boys. Yeah? What we also saw is if there is a boy and a single, if the parent is a single parent and a girl, the probability to have the service early is very high. If the child is a boy and you have a family with a mother with more children, the probability to have a late service is very high. Yeah? So the boys, and being the second or third child, is wait and see. Yeah? I had other siblings, they needed their time, so let's wait. Yeah? So just take a little bit care how to reach your families. Yeah? Well, we heard the data yesterday from Mark. In the Middle European countries, mostly the frequency of the service is once a week, 1.5 hours, or once a week, 1 hour. Yeah? Mostly the services are provided 50% at home, but you also see that in the kindergarten or in the center, the services are provided. Yeah? Well, it's a little bit different maybe than here in Australia. The average distance from the service to the parents is 10 kilometers. Yeah? So there are quite decentralized services and they're quite near. Yeah? So the distance is very, very near, and I guess in some parts of Western Australia, well, you might have hundreds of kilometers to reach a service. So no surprise, families assess the family-centeredness is very important. And the earlier early intervention started, the more important was family-centeredness. And no surprise, the services were assessed as quite highly family-centered, because it is part of our education of the students to start with family-centeredness, that early childhood intervention is for the child and the family. Well, parents of children with high and very high support needs report higher family-centeredness. Parents of girls report higher importance of family-centeredness. I don't know how to interpret this. The younger the child, the higher parents perceive the family-centeredness. And as I told, the setting of the intervention service is not correlated with family-centeredness. And we also asked what is the impact, what is the perceived impact of the early intervention. And parents said, yes, the highest impact is information about my child's development. So also the parents focus on the information. The second impact of early intervention was developmental gains. So my child made developmental gains. The third impact is a family-centered one. The professional is a reliable partner. No wonder, usually our programs run 2 years, so a professional will come at home every week in a 2 years period. Yeah? So and so there is this relationship base between the family and the professional. What I want to point out is that most of these impacts which the families report are highly correlated with family-centeredness. So the more the family assessed the service as family-centered, the higher was assessed the impact. Yeah? So here we see some kind of, even though a little bit weak, correlation between family-centeredness and outcome. Yeah? So if you work in a family-centered way, the outcome is assessed higher by the parents. What we also see is that the outcome related to relationship issues or the outcome related to inclusive issues is still a little bit weak. Yeah? So parents do say, my relationship with my partner ameliorated, slightly not. Yeah? So if we think of family orientation in terms of including the whole family systems, including fathers, including grandparents, siblings, there might be some concern that this is not the optimal way, and we see it in some European studies. So how can we interpret our findings? And I'm looking, oh, the time is running. Family-centeredness is correlated with perceived effects, although the correlations are low to moderate. It is the professional attitude, not the setting, that matters. However, for young children and more severely impaired children, family-centeredness plays a bigger role. Parents attribute high positive effects, although the issue of inclusion, contacts with other parents, and the impact on family dynamics, especially related to partner, is questionable. So these are two open issues about how the systems will evolve. What are the challenges, as everybody of you is working in a family-centered way? To translate the attitude of family-centeredness of professional into observable indicators, behaviors, what Mark said, A, B, C. To listen carefully to the definitions that parents give us about family-centeredness. To face the new challenges of inclusion and to transfer inclusive thinking into early intervention, taking into account that early intervention, due to the age of children, still tends to define its working space within the family and not within family in contexts. I thank Barry about this. So families are not isolated entities, they are living in contexts. And I preach very much if early intervention is going out, going to the supermarket, going to the playground. Yeah? So think if you create new services that the surrounding the environment is is one relevant issue, and that early intervention also has to provide this bridge to the relevant surrounding, and to develop together with families methodologies of sharing and belonging. This is what is in my heart during the last years. And finally, family-centeredness also means trusting in families, self-organization, and creativity. Well, this is a creative way how to cope with daily hazards. Thank you very much. I'm in time.